Dr. Balan, physician in Kovilpatti, practicing diabetes and hypertension for the past 20 years here. As a physician, I used to get more than 20 cases, new as well as old, of hypertension every day in my clinical practice. I like to share a few words about updates in hypertension. As we all know, it's a era of diabetes, which leads to so many complications. But in regard to cardiovascular disease, hypertension plays the major role. So as per the WHO, nearly 63% of total death in India are due to NCD, that is non-communicable diseases, of which 27% is attributed to CVD, cardiovascular disease, which affects 45% of the people in the age of 40 to 70. The raised blood pressure is among the most important risk factor for cardiovascular disease. Even though diabetes is there, hypertension is the leading cause of death as well as morbidity and mortality in cardiovascular system. There are so many awareness programs for diabetes in our setup in our country, but the awareness program as well as getting aware about hypertension is very less. So this is the day for alarm to alert our social workers as well as medical personalities to make awareness to the public about the hypertension. In India, the prevalence has gone up to 10% rise in male and 5% rise in female over the past 30 years. Lack of awareness is the main cause. 62% men and 53% of female living with diabetes, hypertension, they are not getting treated. Even though medication is used, 1 in men and 1 in female, 1 in 4 women, they are getting control. The International Society of Hypertension, that is ISH, it has released practical guidelines to get optimal control for early diagnosis and treatment. The AHA, that is American Heart Association, and ACC, American College of Cardiology, has released a scientific statement in 2021 offering new guidelines for management of stage 1 as well as stage 2, 3. The stage 1 hypertension, which needs non-pharmacological intervention. This stage 1 hypertension, where earlier it was 140/90, but recently the update says it is 130/80. As low as possible is their guidelines. So if not controlled with non-pharmacological therapy, one has to start pharmacological therapy. So earlier, the hypertension was understood beyond 140/90. So we are setting it to 130/90 or 130/80. The cardiologist says to have the BP as low as possible. The neurologists say to have moderate, that is 140/90 BP is good for brain. We, the physicians, are playing role in between these two expertise people, has to balance these both sides to nurture the heart as well as the brain. The diabetes brings more hypertension in diabetic patients, whether treated or not, because it is a vascular disease. The diabetes, a vascular disease, brings or converts the diabetic into hypertension, and most of the patients become hypertensive, which is the leading cause for cardiovascular disease. Most patients with hypertension require lifelong medical therapy to achieve optimal blood pressure control. The European guidelines in 2018, that is 2018, they recommend 5 classes for anti-hypertension drugs. The non-adherence to the treatment or unawareness of the hypertension are the 2 main causes for the lack of success in treating the hypertension. So current setup says lifestyle modification, that is less in diet, sodium, cholesterol, avoidance of alcohol, and avoidance of sedentary attitude is a non-pharmacological approach to make the hypertension control in stage 1. So many drugs are advised. 5 guidelines are there, 5 types of drugs are there to treat hypertension. To start with, in earlier teaching, we the physician we were used to start beta blockers in younger hypertension and calcium channel blockers as well as AC inhibitors in middle-aged people, and then calcium channel blockers as well as diuretics in old age. It's the past teaching in those days. Currently, everybody needs AC inhibitors or ARBs, which are the mainstay in treatment because of the vascular disease. So AC or ARB is the mainstay in hypertension. Putting one drug is not sufficient nowadays. Non-adherence to the treatment, lack of awareness, all this put together compels the medical fraternity to put combination drugs. or fixed dose combination to treat hypertension, taking ACE or ARB as the mainstay, plus any one calcium channel blocker or any diuretic. This will settle and will give good results in hypertension management. And taking reading in outpatient treatment, that is office BP, is more important than the home BP. So it varies. That is white collar hypertension, office hypertension, everything has to be totally monitored, even in the home. So 24 hours monitoring of the blood BP, blood pressure, as well as even that is more important is nocturnal BP reading, which is the key point in making this cardiovascular risk factor. So ambulatory BP measurement or nocturnal BP measurement or repeated BP management measurement is mandatory to diagnose hypertension, to treat hypertension, to prognose, to avoid complications. So we have to prevent primary level of prevention, to have dietary modification, lifestyle modification. Secondary level, you have to start treatment with a single drug. Better to start with combination drugs as early as possible to give good results. And third one is if the hypertension is more, we have to follow it up. We have to investigate more. We have to prognosticate and get it controlled as early as possible to avoid complications. So AHA as well as ACC puts for the hypertension as a major cause for the CVD. It has to be diagnosed before the atherosclerotic changes because it's a vascular disease. The diabetes will make the vessel stiff and create the hypertension. Being in common diabetic era, we have to treat the hypertension along with diabetics. And hypertension is the most dangerous and treatable cause for the cardiovascular safety to prevent the complications. And newer drugs are there to treat hypertension in all areas, starting from beta blockers, as well as calcium channel blockers, as well as diuretics. All the classes of drugs have their own newer metabolites. So combination treatment, co-formulations will give good result in treating hypertension. So early diagnosis, prompt treatment, as well as follow-up will avoid complications and will reduce cardiovascular morbidity and mortality. This is the alarming news for the medical fraternity to diagnose hypertension in their day-to-day practice as early as possible to reduce cardiovascular mortality. Thank you all.